Hi, this is Dr. Padda. I want to talk a little bit about light therapy and what it has to do with pain. I know that we discuss this with our patients a lot in clinic, and sometimes they have additional questions. What I want to do is provide a little high-level thinking about this. When you look at sunlight, you should think of sunlight as more than just simple what you can see, which is the visible light. Visible light is a very small part of the spectrum of what sunlight outputs. And then sometimes, visible light is what reflects off of things that your retina picks up and you can identify. So it's the thing that you use to see your dog. It's the thing that you use to see the tree. It's the thing that you use to read what's on the screen. It's when you have visible light, there's a portion of it that reflects, and the portion that reflects is what you see. So if the object appears to be green, it's absorbing all of the other light and it's reflecting the green. If the object that you're seeing looks red to you, it's absorbing all of the other light and reflecting red, so you can see that. So the visible light is what you can see. And that's majority of what we think of. And that's because that's what we see all the time. That's what we think is important. But the reality is there's a lot more to light. Ultraviolet light, which is very short spectrum light, is invisible to us. And ultraviolet light is usually the thing, especially UVA light, is the thing that causes DNA damage. That's why your parents always told you, hey, stay out of the sunlight because it's going to give you skin cancer. It's really a function of ultraviolet light and UVA specifically that causes the DNA damage. But you need ultraviolet light because it also has UVB in it, and UVB is what allows you to make vitamin D. And certainly there's even more ultraviolet light than that, which can be pretty dangerous, and that's in UVC and even shorter wavelengths, all the way to the point where you can get gamma ray emissions and radiation damage. And so UVA is what is traditionally thought of as giving you DNA damage. UVB is what gets us our vitamin D production. In the visible light frame, though, we think about visible light, and for some odd reason, we don't quite grasp what it does. And we always talk about, well, you don't want to have too much light because at night, if you have too much light, you won't get melatonin production. And that's true. The pineal gland in your brain produces melatonin when it no longer sees visible light. It's specifically in the blue light spectrum, in the blue light visible light spectrum. If you don't have that visible light, your brain thinks that it's in the dark, and your brain allows it to release melatonin. And we normally think of melatonin as a hormone of sleep, but that's not necessarily true. Only 5% of the melatonin that's produced in our body is related to sleep. The other 95% is very relevant for our pain patients. What's that about? So there's another spectrum of light, which is a longer wavelength between 760 and about 1000 nanometer. This is infrared. This is a deep, deep red, or it's completely invisible to us. It might just be feeling like a heat source. This infrared light, it also comes from the sun. This infrared light actually works on our mitochondria, and it works on a cytochrome C system. And 95% of the melatonin produced in our body is produced in the daytime with the exposure of the mitochondria to infrared light. The infrared light goes through the skin, gets into the cells, gets into the powerhouse of the cell, which is the mitochondria. Even the powerhouse of the cells that's deep in our brains, even the powerhouse of our cells that's deep in our livers, it gets through and it penetrates through and it hits those mitochondria, and it affects our reactive oxidase system, and it actually is a potent anti-inflammatory. So if you wanted to calm down the inflammation inside the energy generation part of your body, it would be through infrared light. Now the problem is, as we've spent more and more time indoors, and we have these amazing windows and we start to use LED lighting, all of that allows the visible light through, but it blocks the UVA, UVB, UVC, specifically UVB, and so we don't produce vitamin D, and it blocks the infrared. When it blocks the infrared, we destroy the melatonin production in the daytime, which is a potent anti-inflammatory. If we block that melatonin, we get ourselves in a lot of trouble because then we're in a hyper-inflamed state. We're losing about 90% of the infrared light that we're supposed to have since the 1950s. And that may explain why we're having a significant increased amount of inflammation. Without that melatonin, we have severe dysfunction in our mitochondria. And this leads us to increasing risks of things like metabolic inflammation, metabolic syndrome, obesity. This leads to increased risks of cancer, independent of the fact that we're no longer exposed to the UVA, which is the skin cancer, which is related to DNA damage. If you can't recover your mitochondria and don't have adequate melatonin inside the mitochondria, that increases your risk of cancer independently, and probably to a greater extent than just the DNA damage. The worst possible situation is you're exposed to UVA and you're not exposed to infrared. And so keep this in mind. It's the avoidance of light at night that's really important to stimulate melatonin production from your pineal gland to allow you to go to sleep. But it's the exposure of daylight, specifically infrared daylight, during the daytime to produce the melatonin that is your recovery mechanism and your potent anti-inflammatory. If you have any further questions, please shoot out a text message to me or ask in this particular video, and I'm happy to discuss this further. But I wanted to put this out for my patients because sometimes in a busy clinic it's hard to explain the whole thing. I've got a longer presentation, probably almost an hour-long presentation with the Society of Metabolic Health that specifically goes into the biochemistry of this. But this today was just a quick high-level 30 seconds because I've had a couple questions from our patients. All right, thanks so much.